we were going to be reviewing small volume nebulizers. Now, you may have taken nebulizer treatments previously in the hospital or facility where you came from, and so we want to make sure that you have a great understanding of how to use this kind of machine and therapy in the home setting. So we'll be reviewing how all the equipment functions, how it works, how to assemble all the parts that you need, and of course, probably the most important part of using small volume nebulizers is the cleaning process once you've completed that therapy. So we'll be reviewing all of those topics in this video. All right, so the first thing to know is in small volume nebulizer treatments, if you had ever had this kind of therapy in the hospital or facility setting, these treatments tend to go a lot faster. In the home setting, it can take anywhere from 10 to sometimes even up to 20 minutes to do a normal breathing treatment. But that time varies by how much medication that you have to dispense. So just keep that in mind, that you may be concerned that the treatment's taking longer. That's completely normal. The compressors that we use in the home versus what they use in the hospital or facility are different. So this is an example of a small volume nebulizer. You might have one that looks like this or one similar to it. They all pretty much function the same way. As a reminder, the Horizon sticker is always on there with our phone number, so that if you ever have any questions or concerns, you can always reach out to us. We have somebody available 24 hours a day, 7 days a week to help you with any issues or answer any questions that you have. With any small volume nebulizer, you're going to have an area where the machine needs to draw in air. So please at least leave 3 to 6 inches of space and have a clean environment for this compressor to work. There will always be a power on and off button, an area for you to attach some kind of tubing to. In this case, the port is right here in the front. And then there's always a filter usually attached to a small volume nebulizer, and that's located right here on the front by this tubing. We call the supplies that you need a neb kit. You might see that on your delivery ticket. And it comes in a little baggie, and inside that nebulizer kit comes tubing, a nebulizer cup, this is what will store all the medication, a mouthpiece, what we call a T-piece, and finally some corrugated tubing. This basically allows the exhaust gas to blow away from you. There is also an option in a neb kit to have a nebulizer kit with a mask. So if a patient didn't have the ability to be able to hold their nebulizer treatment for whatever length of time it will take, they can use a mask instead. So they can put this on, breathe in and out normally, just as they would with a normal nebulizer setup, and they can have their hands free to be able to do whatever else that they need to do, or if they just don't have that function. The first thing that we need to do is attach your tubing. And this isn't true for every kind of nebulizer kit, but it is true with this one, is that we have kind of a green side and a blue side. So the green side will always go to our compressor. We'll hook that right to the port where the air comes out. And then you'll notice the blue end corresponds with the blue nebulizer color cup color. So I'll take that blue tube and hook it right to the bottom of our nebulizer cup. Once we have our tubing connected, I would suggest now putting in your medication. You pour that right through the top of this little port here. All the medication can go in there, whatever is prescribed to you for each breathing treatment. Again, you'll pour that right to the top. Once you have the medication inside, make sure that that lid is screwed on and secured tightly. You don't want that to fall apart. We're going to take our T-piece and put the first T-piece there to make that kind of T shape. Then we need our mouthpiece. You'll notice on the T-piece there is a wider end and a more narrow end. So we're going to take our mouthpiece and put that on the wider end. Once we have that secure, then we can add our corrugated tubing. And again, this corrugated tubing really is just to try and keep some of that mist or exhaust gas from your breathing treatment to blow away from you. You don't have to have this if you don't want it on, but because it's there, we use it. Now we are ready to start the therapy. When you're ready to begin, all you're going to do is go to your compressor and hit the on button. Once I turn that on, you can hear the compressor running. This is about how loud compressors normally are. And I can hear actually the air going into that small volume nebulizer kit. You'll notice when the medication is inside, you'll start seeing mist or a smoke start to emit from that. That's letting you know that the nebulizer is functioning and you can start the breathing treatment. When you're ready to start using it, you will put your mouth over the mouthpiece and breathe nice, slow, deep breaths. Don't wear yourself out. You know, it's very common for patients, you know, they feel like they need the medication. They have to ingest it very, very quickly. You don't. Just nice, normal, deep breaths. Your normal rhythm that you would normally do. All right? Same thing with the mask. It's the same process, except instead of, again, adding this T-piece, we would add the nebulizer cup directly to the mask. We would put the mask on and just breathe as normal. Once you start hearing a sputtering, that's likely it's starting to run out of medication, or you really don't see that much mist or smoke coming out of the nebulizer, you pretty much know your treatment's done. You can go to the compressor and turn it off. The next really important part about small volume nebulizer treatments is remember that all this stuff is just supplies. You have to make sure we keep it clean. And this is a breathing treatment, so you want to make sure that although we can't keep a sterile environment in any home setting, we want to keep this as clean as we can. So at the end of the very last treatment of the day, we really encourage you to make sure that you're cleaning all of your supplies after the end of each day. So to do that, what we suggest is taking a small body of water, of warm, soapy water with mild detergent, something like a Dawn liquid soap, and immersing and washing out all of your supplies. Take everything apart and immersing and swishing all the soapy, clean water through all the supplies. You can take actually the cap off as well as the actual nebulizer piece inside. You can rinse this off, again, also with warm soapy water, just to keep everything clean. And then make sure when you're done soaping everything that you thoroughly rinse off with warm water, warm fresh water, I should say, to make sure that you remove all of the soap. Let this all air dry. When you're ready to begin your next treatment, you can put everything back together again and start your next treatment. It's important to note that the only items that you would be cleaning if you're using a mask, please clean your mask, and all of the hard plastics is what you'd be cleaning. Do not wash out your tubing. If you get water into this tubing, we can't clear it, then it becomes occluded and you're not able to actually use the nebulizer properly. So make sure that this tubing stays dry. Now, maintenance. Besides the cleaning maintenance that you should be doing daily after your last treatment for each day, there is some maintenance that may be required for your small volume nebulizer in the home. And that is, most small volume nebulizers have a filter. In this case, it was right here on front. It had this little yellow, like sponge-like filter. It had a little cap over the top. We recommend that once a month you just take this little filter out, rinse it off with warm soapy water, rinse it out with clean water, and then you can insert the filter right back inside and put the cap back on. For troubleshooting techniques, there's really kind of only two main issues that you might see. Either the first one being the compressor won't turn it on and off. Always check to make sure that the compressor is plugged into a safe grounded outlet. Maybe that outlet could be grounded to a switch and somebody accidentally switched that off. So just check that you've got a good outlet. But if the compressor won't work, it is possible that maybe something went wrong with it and we need to replace it. And again, we're available 24/7, and you can give us a call. Our number is right there on the machine, and we'll go ahead and swap that out for you as fast as we can. The second troubleshooting issue that you might have is with the tubing. Just like our oxygen tubing can become kinked or occluded, the same issue you might have with your small volume nebulizer tubing. So if that becomes kinked and you cannot fix that kinking, if you notice that when you're turning the compressor on, you're not able to generate any smoke or mist from that, check the tubing on that as well. If you don't see any tubing issues and the nebulizer seems to be running normally, please again give us a call. If you don't see any smoke coming through and you feel like the tubing's fine, the compressor is fine, it may just be that you need to replace your nebulizer kit, that the nebulizer is no longer able to pass and vibrate that medication any longer, so you may need to replace that. Well, that's it for this video on small volume nebulizers. I hope you enjoyed it. I hope you learned something from it. Although this is a very, very simple and very common therapy used, it can sometimes be a little overwhelming on the day of admission. You know, you forget all the supplies or parts that you need or exactly how to put it together. So hopefully I was able to answer some of those questions and help you out. And as always, please remember that we are available 24 hours a day, 7 days a week for you. Please just call us on our main line, 1-866-575-8901, and a patient service technician will be available to you at any time.